Welcome to RK MEDICO's. In this video, we are going to discuss about different infections of eyes which occurs due to the bacteria. That is different bacterial eye infection. So first, we will start with the bacterial conjunctivitis. So bacterial conjunctivitis, it is the inflammation of conjunctiva of eye due to the bacterial infection. There are three types of bacterial conjunctivitis: as acute bacterial conjunctivitis, hyperacute bacterial conjunctivitis, and chlamydial conjunctivitis. So let's see the acute bacterial conjunctivitis. So in acute bacterial conjunctivitis, there is the mucopurulent discharge from the eyes. Uh, Conjunctival congestion, mild photophobia, and petechial hemorrhages. The causative agents for the acute bacterial conjunctivitis are the Staphylococcus aureus, Pneumococcus, Streptococcus pyogenes. Then Haemophilus aegypticus. So Haemophilus aegypticus causes two types of manifestation, as red eye syndrome, which is also known as Egyptian ophthalmia, and second is the Brazilian purpuric fever. Other causative agents are Moraxilla lacunata, which causes angular keratitis. Which causes angular conjunctivitis at the lateral angle of eye. Then Corynebacterium diphtheria, which causes acute pseudomembranous conjunctivitis. Laboratory diagnosis for the acute conjunctivitis, that is acute bacterial conjunctivitis, is first we have to use the pre-moistened swabs. So that is swabs which are pre-moistened with the saline, and these are used to collect the conjunctival samples from both the eyes. And the sample is sent to the laboratory within 2 hours, and the gram staining is performed, which is followed by culture on the blood agar, chocolate agar, and McConkey agar. The treatment for acute bacterial conjunctivitis is the gentamicin and ciprofloxacin, which are broad spectrum antibiotics. After acute bacterial conjunctivitis, we will see hyperacute bacterial conjunctivitis. So hyperacute bacterial conjunctivitis causative agent is mostly Neisseria gonorrhoeae, which causes two types of conditions. One is the acute purulent conjunctivitis, and second is the ophthalmia neonatum. So in acute purulent conjunctivitis, the transmission for the acute purulent conjunctivitis is due to the oculogenital contact or transmission. Then the clinical features is that purulent secretion of eyes, and it can produce corneal ulcer also. The treatment for acute purulent conjunctivitis is IV ceftriaxone. Then second is ophthalmia neonatum. So in ophthalmia neonatum, the transmission of gonococci to the newborn from the infected mother's birth canal occurs, and acute purulent discharge crustated lesions within 12 to 48 hours of the birth canal. Third type of the bacterial conjunctivitis is the chlamydial conjunctivitis. The causative agent is the Chlamydia trichomatis. Serotypes, there are different serotypes. So serotype A, B, BA, and C causes the follicular conjunctivitis called as the trachoma, and the treatment for this is azithromycin. And serotype D to K causes the inclusion conjunctivitis in both adult and newborn. Chlamydial ophthalmia neonatum is more common than gonococcal. So let's see the difference between the gonococcal ophthalmia neonatum and chlamydial ophthalmia neonatum. So in gonococcal ophthalmia neonatum, there is short incubation period, about 12 to 48 hours. But in chlamydial ophthalmia neonatum, there is longer incubation period, which is about 6 to 21 days. There is purulent discharge in gonococcal ophthalmia neonatum, but mucopurulent discharge in case of chlamydial ophthalmia neonatum. The treatment for gonococcal ophthalmia neonatum is the ceftriaxone, whereas the treatment for chlamydial ophthalmia neonatum is erythromycin. So first we will see the diagrams. So this is the acute bacterial conjunctivitis. You can see the pus is coming outside. Then the second one is the hyperacute bacterial conjunctivitis, and this third one is the chlamydial conjunctivitis. Acute bacterial conjunctivitis, hyperacute bacterial conjunctivitis, and chlamydial conjunctivitis. We will see these from the Apurva Shastri also. So in Apurva Shastri, these are given as this is the acute bacterial conjunctivitis A, this is the acute bacterial conjunctivitis, and this B is the gonococcal ophthalmic neonatum. Then after here conjunctivitis ends. After conjunctivitis, we will see the bacterial keratitis. So keratitis is nothing but the infection of the cornea. So bacterial keratitis is nothing but a corneal ulcer. Causative agents for the bacterial keratitis are the Staphylococcus aureus, Pseudomonas, Pneumococci, Enterobacteriaceae and Enterobacterials and Neisseria. The clinical features of the bacterial keratitis are purulent corneal ulcer, hypopyon, that is presence of pus in anterior chamber, and a laboratory diagnosis for the bacterial keratitis is the specimen collection, corneal scraping obtained from the base and margins of the ulcers under local anesthesia, which help with the help of spatula. Microscopy is gram staining with 10% KOH mount and culture and molecular tests. Treatment for keratitis, bacterial keratitis, is cefazolin plus tabromycin eye drops. So let's see the bacterial keratitis, how it looks. So here we can see this is the bacterial keratitis. These let's zoom this. So this is the bacterial keratitis, which is the ulcer of the cornea. So that's why here corneal transparency will get reduced. So that's why pus is produced in the anterior chamber. So this is the bacterial keratitis. After bacterial keratitis, we will let's start with the bacterial uveitis. So bacterial uveitis is further of two types, as granular uveitis and pyogenic uveitis. So granular uveitis is seen in the tuberculosis, leprosy, syphilis, and tuberculosis and brucellosis, whereas the pyogenic uveitis is seen in case of uh, streptococci, staphylococci, pneumococci, and gonococcus infection. So let's see about the bacterial uveitis, how it looks. So this is how bacterial uveitis will look. Look that red colored portion. So this is bacterial uveitis. After bacterial uveitis, we will see endophthalmitis. So what is endophthalmitis? Endophthalmitis is the inflammation of inner structures of the eyeball. The causative agent for endophthalmitis is the gram. First, let's see gram positive cocci, which are streptococcus epidermidis and staphylococcus aureus. Then gram negative bacteria, which are the pseudomonas, and after that fungi, which are aspergillus and candida. Then attributing factors are the catastrophic complication of the intraocular surgery, then secondary to trauma. And treatment for the endophthalmitis is the antibiotic therapy, in which is intravitreal and topical. Second is the steroid therapy to reduce the inflammation, and then evisceration, which is the surgical removal of the eyeball. So let's see here. This is the our endophthalmitis, in which the interior of the eyeball is damaged due to the bacterial infection. This is endophthalmitis, as you can see. After endophthalmitis, we will see the bacterial infections of eyelids. So bacterial infection of eyelids, there are further divided into three categories. One is the bacterial blepharitis, second is the hordeolum, and third is molluscan contagium. So first is the bacterial blepharitis. In bacterial blepharitis, it is the inflammation of lid margins, which is caused mainly by the staphylococcus aureus. So let's see the picture of bacterial blepharitis. So you can see here, this is the bacterial blepharitis, which is the inflammation of the margin of the eyelids. You can see here, margin of the eyelids, there is the inflammation, which is nothing but the our bacterial blepharitis. After bacterial blepharitis, we will see the second category of the bacterial infection of eyelid, that is the hordeolum. So hordeolum is the acute focal infection of the eyelid, usually caused by staphylococcus aureus. So it is the focal infection of eyelid, and it is further of two types, as the external hordeolum and internal hordeolum. So difference, what is the difference between the external hordeolum and internal hordeolum? External hordeolum is also known as style. So external hordeolum is the inflammation of the glands of G's, whereas the internal hordeolum, external hordeolum is the external hordeolum is the inflammation of glands of G's, whereas the internal hordeolum is the inflammation of meibomian gland. So let's see the pictures of the external and internal hordeolum. So here you can see, this is the external hordeolum, which is also known as style, which is on upper lid, and this is the internal hordeolum, which is on the lower eyelid. These are also given in the Apurva Shastri, as you can see here. So here A and B are hordeolum, in which A is the external hordeolum on the upper eyelid, which is also known as style, and B is the internal hordeolum, which is present on the lower eyelid. So after hordeolum, the third category for the bacterial infection of eyelid is the molluscan contagium. So molluscan contagium is nothing but the pox virus infection in which multiple pearly white wart-like umbilicated lesions over the eyelids and other body parts are present. So here, as you can see, oh shit, we will add the picture in the video. We will add definitely add the picture of the molluscan contagium. In molluscan contagium, there are multiple pearly white wart-like umbilicated lesions over the eyelids and other body parts. After that infection of eyelids, we will see the bacterial infections of the lacrimal apparatus. So in lacrimal apparatus, it is further divided into the two categories as the dacrocystitis and dacroadenitis. Dacrocystitis is the inflammation of the lacrimal sac in which painful swelling in the lacrimal sac region occurs and which is caused by streptococcus pyogenes, pneumococcus, and staphylococcus species. Whereas the dacroadenitis is the infection of lacrimal gland which develops secondary to the local infection or systemic infection. Examples are the mumps or influenza. Examples of systemic infection. So let's see dacrocystitis and dacroadenitis. So here these are the various types of the dacrocystitis in which lacrimal sac is inflamed, and second one is the dacroadenitis in which lacrimal gland infection is there. After the lacrimal apparatus, we will see the infection of orbit, that is orbital cellulitis. So orbital cellulitis is the acute infection of the soft tissue of the orbit behind the orbital septum. So it is the infection of soft tissue of the orbit behind the orbital septum, and which may progress to cause the orbital sepsis. The causative organisms are Staphylococcus aureus, Streptococcus pyogenes, Streptococcus pneumoniae, and Haemophilus influenzae. Clinical features are swelling of the lids and severe eye pain, loss of vision in severe cases, and it is medical emergency. So for treatment, it is medical emergency need to be managed aggressively with antibiotic therapy and surgical intervention. So we will see the picture of orbital cellulitis. So you can see here, this is the case of orbital cellulitis, and these are the pictures from Apurva Sastry textbook of microbiology, herdiolum external and internal. So this was all about the bacterial infections of the eye. If you like this, if you understand something from this video, then please subscribe to the channel RK Medicos. Keep supporting.